everyone. For those of you who don't know me, my name is Aviva Schwartz, and I'm the Director of Content and Education at the North American Thrombosis Forum, NATF. And I want to welcome you to a very special episode of Patient Pulse. So as many of you know, this month, March, is Blood Clot Awareness Month, and that is an annual campaign to help spread the word about deep vein thrombosis, which we call DVT, and pulmonary embolism, which we refer to as PE. So blood clot awareness has always been a core part of NATF's mission. But I want to expand a little bit on the scope of Blood Clot Awareness Month, and I want to discuss an important topic that's overlooked, which is the mental health aspects of blood clots. So patients can experience everything from anxiety to grief to post-traumatic stress disorder after having a blood clot. And so my hope today is that we're going to have a conversation that can shed some light on these key issues and then address ways to manage them. So it's my pleasure to welcome three longtime friends of NATF to join us in this conversation. On the line today, we have Dr. Marie Gerhard Herman from Brigham and Women's Hospital, Mr. Peter Donati, and Miss Christina Martin, and they'll all be sharing some different experiences that they've gone through. So just to briefly introduce everyone, Dr. Gerhard Herman is a cardiologist and a vascular medicine specialist, and she brings decades of experience in counseling patients on the physical and the psychosocial aspects of blood clots. So she'll be offering her perspectives as a healthcare provider and a healer. And Peter is a company executive, a husband, a father, an avid athlete, and he had a pulmonary embolism about 4 years ago. So he'll be offering us the perspective through the lens of a patient. And Christina, unfortunately, lost the love of her life in 2014 to a pulmonary embolism. So we know that blood clots can affect loved ones and friends and family just as much as they can affect patients. So Christina, we look forward to hearing your perspective through the eyes of a loved one. So thank you again for joining us today. Peter, let's start with you. Why don't you tell us your story quickly?
Okay, great. If you can imagine, we were getting ready. We were going to Maine to the Cliff House. I don't know if you folks have ever been up that way. Yeah. It's a beautiful hotel. It's right on the water. And we were friends of ours and we were having a great time. Went up and got a massage on Friday and we were all excited, had dinner. The next day we were out and about. I went for a run, came back. Having dinner on Saturday night, I started to feel kind of like something's bugging me. I don't really feel all that well. And where do I go from here? So of course, our friends were all, you know what, we're going to hang out. And I said, you know what, I'm going to go lay down for a while. I'll be back, thinking I was coming back. And thought I just didn't feel well. So going to bed that night, my wife comes in. I'm asleep, kind of. At about 6 o'clock in the morning, after being awake all night, I'm deciding I need to go to the hospital. And I've never been to the hospital before, so I didn't really know what the hospital was going to entail. But go to the hospital, I have a kidney stone. Well, I mean, I've never had a kidney stone, so I didn't know what the pain was all about. So we've gone out through that. You know, being a man, I'm like, I can do this. That night, I just started to feel worse. Well, lo and behold, Monday, I decide to go to work. I have this kidney stone attack again. And I'm like, what do I do now? The next morning, I go through the same thing. I'm like, I'm okay. Lo and behold, we're going back to the hospital. Pain's intense. What am I going to do? So I figure I have a kidney stone. Okay, we're going to go take care of this kidney stone, Mr. Donati. Well, you'll be in good shape. That was Wednesday. They go in, they take the kidney stone out. Thursday morning, I'm like, have my running shoes in the locker because I was going to go for a run. I'm getting ready to do a half marathon coming up in the next few weeks. So I'm like, okay. So Thursday morning, the doctor comes in and says, Peter, how are you? I'm like, well, I don't feel so good, but he said, well, we can take care of that. Looks up above my head and says, oh my goodness gracious, your oxygen level's at 85. I'm like, I guess that's not too good. So he said, let's run some tests. And I'm like, okay. And in the meantime, my mother at that point is 90 years old. My father's parting words was, make sure you take care of mom and Auntie Flo, no matter what. Being an only child, being the only man in the house, I got that, Pop. Don't worry about a thing. We're good. So lo and behold, they send me down for some tests. I come back up, and the next thing I know, there's two doctors, the doctor who did the surgery, and this is so-and-so from the medicals team. And I'm like, okay, this is not good. He says, well, we want to inform you that you have multiple PEs. And I'm like, oh my goodness gracious. So I'm like, okay, doc, what do we do from here?
Can I ask
And
you a question, Peter?
yeah,
Had you ever even heard the word PE before
I
that?
never knew what it was. I had no idea. I never thought I could die from this thing. That was the last thing in my mind. At that point, they put me on some medication to kind of get me back to normal. You know, it took a couple of days. I was in the hospital till Sunday. I'm actually working. I'm in the refrigeration air conditioning field, and I've got customers calling out. It's, you know, it's that time, and I'm like, all right, what do we do now? So, okay, I can do this. So Sunday morning, you can go home now.
And they
And
had you on a blood thinner?
they had me on a blood thinner. Okay. So I come home, and of course now I'm kind of lazy and weary, and I'm like, I don't really know what I should do, what I shouldn't do. So I'm like, okay, doc. He said, well, the running's going to be out for a while. I'm like, well, I've been swimming 3 days a week and running. So I'm in probably in the best shape I've ever been at this point, and now I can't do anything. So of course, time goes on. Being a father of three girls, I'm like, all right, you know what? I have to pull myself through this and kind of stay strong, because what do I do at this point? I don't know any better. So I've never been home at night. I've been on my feet all the time. I'm a go-getter. Like, what do we have to do? Well, it just happens this one night. I wake up in the middle of the night and I'm like having an anxiety attack. Like my chest is like bouncing out of my, I don't know what to do. My heart's pounding like crazy. And I look at Dawn, I'm like, you know what? What am I going to do? I don't know what to do at this point. So lo and behold, one of her associates that works at Children's gets a hold of Sam Goldhaber and said, look it, can you take a patient? And he's like, well, you know what? Yeah, you know, if you know Sam, he's like, all right, come on in. You know what? If it's someone's friend, come on in. So he takes me in and sits me down, and he said, and he was as calm as could be. He's awesome. I love the guy. And he says, you're going to be fine. So he puts me on Xarelto, and I'm like, what else do I have to do at this point? He said, just don't bang yourself up. You know, if you start bleeding, you're going to be bleeding more, you know, no trauma. So of course we put the skis away. You know, I said, well, as long as I can't get hurt in the water, and I hopefully can't get hurt if I'm running straight ahead and not doing anything kind of crazy. And, you know, whenever my mother at the time was like, where you been? You know what? She don't realize, you know, she's always been saying, you're 60 years old, you're 60, you got to slow down. But it's not that I'm not one of those guys.
You don't have to slow down.
Yeah. So I wasn't slowing down. So after meeting Sam, he said, I have a suggestion for you. And I'm like, what is that? He said, we have this support group that meets once a month. So I'm like, you know what? It doesn't sound like a bad idea to me. So a little time goes by, and I have this, I'm home again, and it's just, I'm at the house, and I'm like, you know what? I said to Dawn, I think I want to go there. So we decided to go. It was the first Tuesday we went, and it was so crazy because it's pouring buckets out. I mean, literally pouring buckets. And we're in the conference room, and there's probably 15 of us, I think. Okay. And we're kind of crunched in, and I'm looking around because I'm the new guy. And this other gentleman, Bart, who became my friend, we've always been together now. And so I'm looking at him. He had open heart surgery. And I look over, and I see this gentleman put his biking shoes on and his biking helmet. And he's older than I am. So I'm like, how the hell did he get here? And he said, I rode my bike here, and I've been a patient of Sam's for like 20 years. So at that point, I'm like, well, 20 years. So we go around the table, and everybody's telling the story. And I'm like, it was probably the best night of my life. I can't even imagine it. I get emotional telling about it, but it was pretty cool. And I just feel comfortable with the folks that I meet there. In fact, I did a little video for Sam Goldhaber, and I don't know if you know Lynn Jennings. She's a cross-country Olympic athlete. Yeah. We had a function and she was the guest speaker. So me being a cross-country athlete, I was like in heaven at that point. He said, would you mind doing this? And so I'm sitting here with my wife, and Lynn Jennings is sitting in front of me, and I'm like, oh my goodness gracious. So we had a great chat because she had the same thing. You know, and realizing that people that are way more important than I am, and way better athletes, and people that of different, you know, anything that goes on, it can happen to anybody. And I wanted to know, how did it happen to me? rather than someone else, and what brought this on. So that's pretty much what my story is to this point.
You brought up so many important points, and we're so glad that you're okay and that you've recovered. One thing I do want to follow up on is you readily admitted to us the anxiety that you were feeling after your blood clot. But for many men, it's a little bit difficult to admit sometimes that there's some anxiety. And for women as well, there's fear of social stigma and providers who may not take you seriously. So I'd love to hear from you. What was that point? Was it that anxiety attack that you were having? How did you know that you needed some help?
I thought at that point, I'm like, I don't know if I'm going to be okay.
Mm-hmm.
I was kind of worried that if something had happened to me, what would happen to the girls? What would happen to my mother?
Yeah.
Who's going to take care of them? And I mean, a male dominant Italian, I'm like, you know what? My father was a 6'2" like a rock. And the next thing you know, he's in a hospital bed, at one point with an aneurysm. I'm like, so is that going to happen to me? I was kind of like afraid of that. So I kind of put my ego in my back pocket and said, look, when you're worried like that, you kind of have to outreach. We see it now with people hiring therapists in this whole COVID thing. It's like people are afraid. What do I do? How do I help myself out? I really needed someone else like Sam and like the support group to look in other people's eyes that have been in the same position as I am and reach. If they can reach out, why can't I reach out and help myself?
Can I just say, Peter, it sounds like I hear two aspects to this. One is that what exactly happened to you and why it happened wasn't clear to you.
Correct.
Which I think is huge. And I would encourage everyone to really dive in as deeply as they need to with their physicians to figure out exactly what the problem is, physically what happened, what contributed to what they're feeling, etc. And I don't know if part of the issue for you was that you had, so much going on. Kidney stones are as bad as giving birth in terms of pain. And it's harder to actually clue into feelings of shortness of breath or any kind of chest discomfort. Because it sounds like you were in pretty bad shape by the time they picked up that something was wrong because of the.
I want to tell you, when I went to the ER, that was on Monday. She said, can you take a deep breath? I said, I haven't taken a deep breath since Saturday. I was literally just kind of like, and I thought, yeah, I'm okay. I just maybe because it's kidney stone, I can't really breathe all that well. And not thinking about that because back to, I'm swimming for 40 minutes, 3 days a week. So I'm in the pool and I'm like pounding away. And I'm like, maybe it's just that maybe I'm overtired. I couldn't figure out what it actually was at that point.
That is actually another common point that you're bringing up for a lot of people, men and women, that they want to ascribe whatever they're feeling to stress and not, thinking about the impact of stress on their body or to something that is exogenous to them. And I think the other thing that the second part of your story that's so important is, so this happened, you don't know why it happened, you don't know exactly what it is that happened, and then you have to know what's going to happen next. Like, that is incredibly difficult.
That was anxiety to the max. Literally, I would be in the car because I was working and, you're driving along and all of a sudden you kind of say, well, am I breathing okay? Am I all right? It's like when having the COVID, it's like, okay, I had it in December and I thought, well, I'm tired and I should be okay. And I was feeling all right. And I didn't really have it, thank God, all that bad considering, but it was that feeling again, like, am I going to be okay? Always having that little bit in the back of your mind, like, if I don't take I need to be on the medicine. And I was diligent to take that Xarelto and make sure that I was on it
Yeah.
Because I was worried about, among other things, first, if I fall down, I'm going to start bleeding. So of course that happened to me one day. I'm out on a run and I'm 2 miles from home and I'm falling on my face and I'm all scratched up and, all hell's breaking loose and I'm kind of bleeding, and it takes time to get better as far as that, but it did get better. So that was okay.
Yeah.
I mean, you have to laugh about some of these things because it's crazy how things happen.
That brings up the other point from what you're saying, though, that things do happen. So us worrying about them happening doesn't make them happen or not happen necessarily, right? Yes. So I think that I hope anyone listening to this can be better armed and in a better situation that Peter ended up being by asking your physicians, anybody taking care of you, what exactly happened, what symptoms should I be looking out for, what do you see? And then after you get treatment, the same things are still going to come into play. Like, what problems do you think I could have? I'm glad that you heard about falling down or, having trauma and bleeding, but how would you know if there was something else wrong with your breathing, like happened with COVID, for example? Mm-hmm. And people need to be told that we believe you and you're going to be looking for these symptoms. And we don't expect these things to happen if this happens. So, for example, you have different pain in your chest. You notice any change in your breathing, let us know. We can work through this with you and figure out what's going on. I think that's there's actually one other thing that's even more important. I was doing it with a patient upstairs, actually, right before I came down, which is that you're going to reach out, you're going to recognize you have a problem, but at the same point, you're under stress right then. You're under stress right then, and we don't want that stress to have an impact on your body. Mm-hmm. In terms of blood clots, the big thing is that stress is going to cause arteries and veins to clamp down. It's going to increase cortisol and sort of rev up your inflammatory system a little bit. Kind of the last thing we want to happen. So even as you recognize the problem and you're moving forward, you got to step back, say, I'm doing what I can do. And actually, it sounds a little counterintuitive, but take as deep of a breath as you can. 4 seconds in, 4 seconds out, at least a few times. And you drop the cortisol and the adrenaline that's starting to mediate this bad effect on your body so you can decrease the impact. And I think the other thing that Peter said that's so important, and actually everyone has said it to some point, there's stress associated with DVT and PE, clearly. But right now in the current environment that we're in, stress all the time. So we have to think about decreasing the impact on our body. And I think the big thing with PE is, what am I feeling? Is this something to be expected or not expected? Actually doing what you're doing, getting out and running all the time, are one of the things that I tell people to do. If you have the same kind of exertion every day, and then one day you notice there's a change in what you can do, your provider needs to know about it. It could be something related to the blood clot in your lung. It could be something else, like a new infection. But people need to pay attention to you and take you seriously.
Those are all really important points. Christina, I do want to hear a little bit from you about your experience. So you suffered the trauma of losing someone you loved to a blood clot. So tell us a little bit about that experience, what you learned from it, and how you deal with anxiety and grief that stemmed from that experience.
Yeah, so I met Mono Williams. His name is Mono Adrimu Williams when I was 14. So I was a freshman. He was a senior. I was a nerd and he was popular. So and I'm dating myself here, but 1995. We were dating and were engaged at one point. But I think, kind of going into the meat of it, especially as Peter was saying, there's this kind of man up mentality that a lot of people don't address. And Mono did suffer from blood clots. The first time he did is he had a broken ankle. And I got to tell you, I didn't even take it seriously. I think he was probably in his mid to late 20s. And so in my mind, they said a blood clot. And I thought, oh, a blood clot, a cut, right? Like same difference. They didn't even really make a big deal about it. They did put him on blood thinning medication.
Christina, did they say anything to Mono about this is what a blood clot is and this is why we treat it and what we're worried about?
Yes, they did. And he kind of resounded that message, but I don't think it really resonated with people my age. It just really didn't. The thought that someone could pass away just didn't really resonate with me because he was so healthy. He wasn't a 300 pounder. He looked like a defensive lineman, right? So like he could run faster than I could. It wasn't the typical case. And so I never thought that somebody like that could pass away. In 2014, I wasn't with him when he actually passed, but I do remember him talking about going to the doctor, saying that he didn't feel well. He was taking blood clot medication, and nobody really did anything, right? And so the doctors kind of played the same game that I think, Peter, you were kind of talking about, where it's like you go from one doctor to another, you try to explain your case. They don't fully understand. I don't understand. I just didn't understand the significance of what a blood clot can do. And in 2014, he passed away from a pulmonary embolism. I believe he hit his leg. And by the time he got to the ER, it was too late. And so it was very, very, very difficult. I was in my mid 30s at that point, and I just didn't see it coming at all. And with that kind of grief, most people my age don't understand it. I think they understand it now with COVID, but at the time, suffering from a loss like that, being with somebody over 20 years and you're only 34 years old, is very difficult. And you feel more like a widow than you do like who lost their boyfriend. And my friends still didn't really understand. So there was a part of that I didn't even want to speak to anybody about, because they just didn't get it. It was a lot of, this happens, you could get over it, because the people who my friends, they never lost anybody. They have both of their parents, they have their dog, they have their grandparents, they have their great grandparents. And so they just didn't understand loss the way I did. And so with that grief, he was 36 when he passed, and he didn't even have a headstone, because we don't expect somebody at 36 to pass away. So we're not really in the financial place to be burying somebody, with a $15,000 bill, and like people aren't just ready for that. Right. And so when I went to to the cemetery, and it was just a dirt plot, that kind of ignited me to say, no, like this changes today. And so my background is heavily in marketing, and I put that to my own use and said, instead of just buying him a headstone, let's educate people about the dangers of blood clots. And I started my business called MAW, which is Mono's initials. At first I thought I was teaching people about blood clots, but the more I started going into my business, I started realizing that the people who were kind of my customer base were people who had a blood clot, and they were now grieving it. And I realized that I had to optimize my business plan, because the first thing I did was a 5K race in Chicago. And the people who were actually signing up were people who lost their loved ones or who suffered from a blood clot previously. Those were the people signing up for my race. But my initial reason for setting up my business was to educate people. So I had to kind of change the trajectory of my business model, because the people who were coming to my race already knew the symptoms. They already knew what medications to take. They already knew the signs of a blood clot, because they went through it. And it's horrible. But most of the people either was from death or someone who suffered from it. Yeah. And so I needed to change. And so my second promotion I did was a video game tournament, because of what Peter was saying, the man up mentality. And I targeted men 18 to 44, which is the biggest segment of men who play video games. That was a dangling carrot. I got people in the door because they saw this big title and they started signing up. But what they didn't know is that in the background, I would be educating them about blood clots. Now I had a forum to educate, because what my objective was to not have a person crying over a casket. And in order to do that, I have to educate them before it happens. So in a nutshell, that's my story. I don't really like to talk about the bad parts of it, because I really like to celebrate his life. content and education is the key to saving lives.
I think that you're empowering people when you do that, actually, Christina, because Peter outlaid very nicely for us not knowing things going in. So if you have knowledge of symptoms, knowledge of potential outcomes, you as the patient or you as the spouse or the friend actually have knowledge to help empower you for the situation, because that is a clear part of what I've been hearing from everybody is that we have to advocate. We have to advocate for ourselves.
There's no question.
And ideally, it should be the patient, but exactly as you said, Christina, you know, the person standing next to you can look out for you too. So people know what to be worried about. They can advocate for you. At the same time, they're going to be taking deep breaths and moving forward.
Yeah. Dr. Gerhard Herman, I wanted to ask you, we talk about this patient advocacy quite often, but a lot of times it's easier said than done. Sometimes we find that patients are afraid to speak up. Sometimes we find that they feel their physician or their healthcare provider is in too much of a rush, or sometimes their healthcare provider will really be focused on those clinical aspects of the illness as opposed to the psychosocial and emotional aspects. So what is your advice to help patients kind of break through that barrier if they feel that they're being faced with it, or loved ones who have lost somebody? That's obviously very anxiety provoking too. So Christina has obviously channeled her grief into something so much bigger than her that's been really productive. But, you know, in terms of just helping to advocate.
It's still alive, and we're still here to listen to you, by the way. So there's two things here. One is actually what Christina is doing is huge. If people are armed with words that a healthcare provider is going to recognize when they describe their symptoms, it's good. Just saying anxiety by itself actually makes some people run away. They say, oh, anxiety. But anxiety exists for a reason, because there's something going on in my chest. I can't really breathe. I don't feel comfortable. So I think that the patient has to persist. And if it feels like you have a problem, it hasn't been addressed, you keep going. So there are a couple things that you said that I think are important. One is make sure that your specific problem has been heard. Even if you ask the provider to tell me what you think I'm saying so I can make sure I'm being clear, because you want that channel of communication open. The other thing that you said that's true but a tad disturbing is the provider feels rushed, or you sense that the provider feels rushed and they're not going to attend to all your questions. If at the end of your interaction you feel like you have questions left, you say, I still have questions. How can I reach you to answer these? Is there someone else I can talk to? Can we schedule another visit very soon, etc.? So don't leave questions on the table, concerns on the table for too long. And I think the other thing about this is the manning up part is quite real. And I would lead on Peter for this a little bit. I don't know how we can bring that back down other than the spouse or the loved one sort of pushing you through the door. We want the patient to describe their symptoms as clearly as they can, and be aware of those words that may make people run from the room, like anxiety, or for any woman that says stress, even though stress is a bad thing that we feel every day and is having a bad impact on our bodies all the time. There's too many people that say, stress. Like, stress causes the problem, or anxiety causes the problem. Those things are responses, not causes. So patients have to stay at it till someone can answer their questions. And I feel bad if they have to go to a different doctor or a different emergency room, but people can't leave with questions unanswered. People can't leave still feeling bad.
I always say that within my advocacy, I always tell them that what a blood clot is. And once people realize what it is, I use that as like a trigger word, because saying my leg hurts isn't enough for a doctor to do anything. And I think that's kind of some of the reason about why mono passed, because a lot of people are not medically inclined and they can't really describe what they can do. And from a marketing perspective, people will tell you what they think is the biggest piece. And what they may say is, I feel anxiety, I can't breathe. And a doctor who's in the middle of COVID is going to say, there's lots of people who have anxiety and can't breathe. But if I say, you know what, I don't know, I think I have a blood clot, like that's a red flag. And blood clot, the word blood clot itself is such a red flag that it's almost like a liability. And so I actually educate a lot of the people who I am with, is to say, these are the facts of what a blood clot is. Blood clots can kill you. And these are the 10 things that can happen and how you can get them. And so I've actually had a few friends who drug their husband or their boyfriend or their brother to the ER, and their brother is like, I'm fine. And the advocate with them, either their wife or their sister's like, no, I think he was a blood clot. And then immediately the hospital's like, no, we have to screen for you. So I think it's on both sides of the spectrum, where you're just so defeated after you can't describe your symptoms properly. My leg hurts, I don't feel well, I can't breathe. And like everyone is like, can't help you. But if you know what they are and you use trigger words, especially in a hospital environment, I feel like you can potentially get more treatment.
You know, the other thing that's very good point, actually, trigger words. I like blood clot. I like putting I can't breathe before even mentioning the word anxiety. The other one, if you have a sense of doom, an impending sense of doom that you can communicate, that is a similar red flag. No one's going to let you go without figuring that out, I hope. But no one should let you go without figuring that out. And I think that would definitely help someone in Peter's situation.
Well, that happened on Tuesday night when I was at the hospital. And I think they kind of realized in my face that, you know what, something else is going wrong. And and my wife said to him, his oxygen levels in the tank. And as soon as they hear your oxygen levels in the tank, boom, now we're snapping to action here, because if you're in that good a shape, why can't you breathe? And it's kind of, when you don't think about that and you've never had that feeling before, I'm like, I can't, they're putting oxygen on me. I'm like, I don't know, maybe I do, maybe I don't. And maybe it was the medication that they gave me, but it was definitely a wide opening, your eyes open at that point. Like, how do I feel now? And I mean, I couldn't feel, even when I walked out of the hospital on Sunday morning, I was like, should I go? What do I do next? You always feel that, like, what can I do next? Are you okay? And I just think it takes time to learn that process and all the stuff you're doing. I mean, you think about all the people that are in the road race. We've all had a blood clot, so we're keeping an eye out. If I don't feel well, and now it's like they're always saying, "Dad, are you feel okay? Are you all right? Are you okay?" And I mean, I've never been to the hospital. I've really never been sick. So when you feel like that, are you okay? Is everything all right? What's wrong with you? People ask now, because even my friends are like, if they see me where I'm kind of down, they're like, what's wrong with you? You don't seem like yourself today. And, you kind of perk yourself back up, like, wait a second, I'm kind of letting my guard down here. That's really not what I do. But on that respect, it's like knowing the signs, all the stuff you guys are doing, being an advocate for yourself. I think that's so important at this point, to realize that I can't leave this hospital because something else is wrong with me other than this.
That's actually a huge point, that after the diagnosis, we still have to deal with what happens next. Like what then happens? Like Mono already had one DVT diagnosis. Did anyone talk to him about what would happen next, or what things to be scared and not scared of? Mm-hmm. And I think that we can empower our patients once we get them there, talking about, I'm worried about a blood clot because of the pain in my leg, or I'm worried about a blood clot, I can't breathe. After they get a diagnosis, what do they expect next? They have to talk to their physicians. Like, should I be able to run up the stairs tomorrow? Should I be able to run up the stairs next week? What do you think is going to happen? Hopefully everyone at least talks to the patients about the downsides, like if you suddenly can't breathe again, or if you have new chest pain or new leg pain, please come back right away. But I think we can frame it in a positive way for people too. We're giving you this treatment. We don't expect bad things to happen. We know that this treatment is very effective. This is what we think should happen to you now. And this is what we expect. And you can help by, and you have to give some power back to the patient. Drinking enough fluid, staying active, taking your medicine at exactly the right time, so that they don't feel like a victim. And both of you guys, Christina and Peter, both have described this just sad state of being a victim in all this. And whatever power we can give back to people to help cut down on that, I think it actually would be huge too.
I also think it'd be great if they had like some kind of, there's kind of a stigma to a blood clot. And I think that's what's confusing to people, because initially, and I think, Peter, you mentioned Xarelto, it was like Arnold Palmer, right? So like in people's minds, they think you're over 65, you're not healthy. Like there's these things that people think that's what a blood clot. And so when they get one, they're like, I swim, I do this, I don't have one, I'm not overweight. And it's like, it has nothing to do with any of those things you just said. And it's just really getting that out, because a lot of people have this personality or this persona that doesn't exist of who actually has a blood clot. And I am trying to stop that, because any of us on this call could get one. It has nothing to do with anything other than you having a propensity to get one. And I don't think that people, I think the bigger population feels like, oh yeah, my grandpa had one, right? They don't think like a 19-year-old high school student who runs track would get one. But yes, he can get it too. And there are professional athletes that are now coming out saying that they have it as well. And I think it's a great way to get people just aware, because in their minds, I don't think they're even aware. And awareness is like, yes, anyone can get this. Just like COVID, I think now everyone understands you could be 4, you could be 94, right? Blood clots, I still don't think that there's enough understanding that you don't have to be a certain age or weight or whatever that is. I constantly have to tell people it can happen to anybody.
I just have to comment that kind of mindset, Christina, is available to everyone, everywhere. And it just, nothing particular happens to someone once you pass a certain age or once you pass a certain weight. And I think when we ascribe the age and the weight as the problem, we're taking away from the patient, and that's not helping us. So I agree with you. We need to say anything can happen to anyone. These are things that you can do to try to keep yourself as healthy as possible.
Before we wrap up, I do want to just dive into the fact that having a blood clot, we know, puts you at risk for having another one. So there is a risk of recurrence there. So we've talked about how to manage the anxiety immediately post-diagnosis, but I want to talk a little bit about the self-care that we can practice along the way, 5 years out, 10 years out. I mean, Peter, you said you're about 4 years. And Dr. Gerhard Herrmann, you said something interesting, which is that worrying is not going to make something happen or not happen. So what do we do so that we are not constantly just living in fear of the next time that happens?
That's huge, actually. I think part of this is, actually, Christina alluded to it, but empowering people with knowledge. So I'm treating you for your blood clot. You're on a blood thinner. I may or may not know why you had this, but these are the predisposing things potentially that led to this happening. Just because you had this, you're at risk again, no matter who you are, because the blood clot itself damages the veins, and then they're not the same after that. So no matter who, you're always going to be at some increased risk. So should I worry every day that something bad's going to happen? No. You should drink fluids, exercise 30 minutes a day if you can, pay attention to a diet that's healthy and has lots of vegetables and fruit in it. And these are the things when you should separately worry. I have a new discomfort in my leg. I suddenly have new swelling in 1 or 2 legs that I didn't have before. my breathing is different. And God bless everyone, Peter. I hope the patient themselves can recognize their breathing is different. But if anyone else around you tells you your breathing is different, then you can worry enough to call me and let me worry.
Exactly.
So you have to have a provider that's invested. So you're not going to say, oh, my breathing's different, and then just sit there and worry for like a week. Mm-hmm. You're going to start taking deep breaths as you pick up the phone and get medical help. And the same for any new chest pain, any feeling of lightheadedness, or feeling like you're going to faint, or actual fainting. Those are the times when I will allow you to go ahead and worry and get a hold of me. Otherwise, I think that people should do everything that we're telling them. We know this will give you power to live your life the best you can, so keep doing that. So that's I think, how we can go on with the illness, move forward, and limit the impact of worrying about the illness on ourselves. I mean, I'll put some more stuff on the side in terms of the impact of just constant worrying, but it's not good for us. You all probably realize that.
Mm-hmm. Right. Peter, you mentioned the support group and how huge that's been in your life. How are you dealing with this now that you're 4 years out? What's your day to day? Is this something you think about a lot, or you're just living your life?
I pretty much live my life now, knowing that I have that life preserver waiting if I need it, which has been great for me. You know what? I'm back to doing what I did before, running, biking, getting out and doing, exercising as much as I can. And talking to Sam, that was one of the goal things, like you said, Marie, stay active, keep doing what you were doing. You might not get your speed back, but I mean, I don't mind that anymore, because at 65 years old, you know what? I remember when I could run a 6-minute mile, and I can't do that anymore. So, but just being out there and enjoying the part of it is so important, that I feel. And knowing that, you know what, there's things that I can't do and things that I can do. And just being prepared if something does happen. I have an ID tag on my sneaker now, that here's what I do. So in case I do fall down and hit my head, that's an important thing. You don't realize that people say, oh, what's the big deal? I'm like, you know what, if I'm 8 miles from home and I fall down and I'm on the ground, at least somebody knows to call my daughter, call my wife and say, look, we found your husband on the ground, dad's on the ground. And you know what, what would you want to think about that? But, that's my goal, is to move forward. I had a great advocate. My mother was 90 years old and walking a half a mile at 90 years old. So she'd be like, here I go, and hopefully that'll be me, but, she was never sick either. So I'm realizing that when you have those good genes, you're like, how could this ever happen to me? But I think being positive and moving forward, feeling good about yourself, there's always going to be days where you're going to be down and out, but I mean, like today, I was kind of waiting for something to happen to me. Like, I should feel lousy today, but I felt okay. And I'm like, you know what? Let's move on from this. So we'll be fine. It'll be good.
Dr. Gerhard, what is your mantra? It's the healthy legs for a happy heart, right? That's what you say?
Healthy legs for a happy heart, baby.
Yes. Actually, and I think we can argue a healthy mind too, right? Healthy legs for a happy mind too.
Well, the happy is supposed to be for the mind. So with exercise, you're increasing flow everywhere. You're improving the health of the blood vessels. So it's legs, heart, brain, lungs, all important. Mm-hmm. I do have another mantra, though, speaking of what Peter just said, which is, and it'll be the title of my upcoming book, which is Unpleasant Things Happen. They happen. We acknowledge them, and then we move on. And I think that that's where Christina's story is really important. Like,
exactly right.
How do you reach out to other people? How do you process that together? That's mighty tough.
Absolutely. Christina, do you have any parting words for us about how people can survive and thrive?
Yeah, I would just say that it's just important just to understand that, like, unpleasant things do happen, but you can make pleasant things happen with it. And so I really love the fact that I get to work with NATF. I believe in 2018, I'm a runner myself. I think I ran for I did the Chicago Marathon and then the hot chocolate run as well, with NATF on my back the entire miles. And so if they didn't know what NATF was, 40,000 people know what it is now.
There you go.
It's just good to just get out there. And I think it's just awareness. People don't know. And now they know, at least they know something. And it just gives them an opportunity to, blood clots. I think this actually gave me an opportunity to kind of have a voice. And I do thank NATF for giving me that opportunity, because it's just devastating when you think you're alone and then you realize, oh, you're not alone. There are so many people out there who are dealing with the same thing, and just coming as a community and then spreading the word together.
Absolutely. Well, that is so powerful. I want to thank all of you for joining this and being so open and honest about your experiences. I think this will make a lot of people feel less alone. Dr. Gerhard Herman, you said you will give us some resources, so we will link to those. And Christina will also link to your awareness campaign as well. So everybody will have a ton of information. Yes. Yeah, so thank you all so much. It was a pleasure doing this with you.
It was lovely working with you guys.
Great. And I hope that everybody has a happy and healthy rest of Blood Clot Awareness Month.